Many people are very afraid of having back surgery, and they feel that if they come to see a back specialist or a spine surgeon, that means they're definitely going down the path of surgery. But you just stated that oftentimes they don't need a surgical correction.
Right.
So it's figuring out who should have surgery and who shouldn't have surgery, and how do patients understand how to make those decisions, or even what questions to ask in that journey.
Yeah, I think, well, Peggy's perspective, my perspective is the way I approach it is my job is to educate the patient in front of me. So I'm giving them facts. I told Peggy, that basically, she had a very significant scoliosis that was going to continue to progress. We had documentation of progression. Her quality life and deterioration of quality life had correlated with her progression, which is very common, but not universal, interestingly. And so her natural history was just continued deformity progression and continued deterioration of quality life. And so there comes a point, again, for her to decide, as I told her, where she realizes that she wants to get off that pathway.
Yeah.
And for situations with her degree of scoliosis, the only solution then to get off that pathway was with surgery.
Surgical correction.
But again, that's not that common, actually. It's much more common. You can get on a better pathway with non-surgical means and only have surgery as the last resort.
Mm-hmm.
But again, I think the key is for the physician/surgeon to educate the patient as to what their problem is, what the expectations are in the future, and what you can do short-term and long-term to get a better quality of life. That's what it's really all about.
Yeah, it's that quality of life. And a lot of times people will ask me, I'm just going to put this off as long as possible. And that's not always the best advice, I think. And I'd love to hear your comment about, waiting too long. Maybe your options are worsening over time, that there's a time in there where there's a window that's optimal for patients. And Peggy found that window where you said, when you're ready, you'll know. But that's, again, no cookie cutter solution, and it's different for every patient.
So beyond educating, I also tell patients this is very common because I see patients in the spectrum of quality of life deterioration. Some are very early in their spectrum, but with a very severe deformity, and some are very late with an even milder deformity. But the key is that if their deformity is progressive, and over time, if we have documentation that their quality of life is deteriorating, then they do have a decision to make. And what we do know, unfortunately, is that as time goes on and as the deformity progresses and the symptoms progress, unfortunately, people age. And often the aging advances exponentially because they're less active.
Oh.
So we get to a situation where patients have now a more significant deformity, which requires more significant surgery, a bit riskier surgery, and they're not as healthy as they were 5-10 years ago.
Cardiovascular wise and everything.
So I'm pretty open about patients, telling them that's fine. You can decide when to have this, and I'm never going to force anyone to have scoliosis surgery.
Right.
But the bottom line is, if you wait 5 years, the risk of going through surgery are going to be exponentially higher, and it varies patient to patient. So obviously, based on their overall condition. But as I tell them, nothing gets easier or better for the patient or the surgeon as one ages with a chronic condition like severe scoliosis. Nothing gets easier or better for the patient or the surgeon whoever's doing the surgery.
Right.
It's harder.